Amin Salahuddin, a doctoral student at Cal University, concentrating on healthcare management and leadership. My topic is on U.S. healthcare system. Before I continue, I would like to elaborate on two key items. First, achievements. No doubt, we have achieved state-of-the-art technological advancement in the healthcare system's application. Laws have emerged, such as HIPAA, ARA, High-Tech Affordable Care Act, and many others, to support the healthcare system and improve the quality of care. Enforcement agencies have emerged to enforce the standards within the healthcare system. Community organizations have contributed to improve the system. The second key item is national health expenditure. I would like to emphasize on the total national health expenditure for 2009, which was $2.4 trillion, covering 307 million lives. But yet, Commonwealth Fund surveyed 6 developed countries for the best healthcare system. Unfortunately, U.S. ranked last. This raises a concern as well as a question that how do we improve quality, efficiencies, and reduce costs? My approach is a cohesive, horizontal healthcare system design. Let's look at the core stakeholders and driving factors of transitioning U.S. healthcare system. They are patients such as own private insurance, public funded insurance, out-of-pocket and uninsured. There are providers such as hospital, primary care, labs, pharmacy, dental offices. There are payers such as Medicaid, Medicare, commercial, workers' comp. There is exchange gateway such as health information exchange, clearinghouses, business associates, portal. Surrounding that, there are laws, standards, communities, technologies, and associations. Now let's look at the current provider, payer, and patient model. All the entities associates with various systems or applications. In many cases, one system rarely interacts with another system. For example, payers, claim system, and electronic medical record system. In other words, current infrastructure is vertical architecture. There are many advantages as few were identified in achievements, and certainly there are disadvantages of current vertical architecture. First disadvantage is that it is difficult to comply with Affordable Care Act. It is also difficult to comply with High-Tech and HIPAA Act, where auditing, accountability of disclosure, and traceability is mandated. It has scattered sources of information, rising costs of maintenance, support, and expansion. So far, we have reviewed the current vertical architecture. Now let's look at horizontal architecture to streamline processes. What we need to do is leverage the cloud-based architecture and transform vertical system into the cloud from payer, provider, and patient model to successfully streamline and integrate systems. I understand that horizontal architecture is not simple as it sounds like. So let's look at HIPAA Act's Administrative Simplification Transaction and High-Tech Act's Medical Record Process Flow as a use case in the cloud. There are various business models, but I will focus on commercial insurance HMO model. So the administrative simplification begins when new employee is hired. The first thing the employer does is submits an 834 enrollment to the health plan along with the 820 premium payment, opening the door for the employee to visit healthcare provider as an insured. Upon a visit to a provider, the first thing the doctor's office will do is send a 270 an eligibility request transaction. Her health plan responds back with a 271 with detailed benefits. Provider then sends the bill, the 837 transaction to health plan. A health plan responds back with an acknowledgement, which could be a 997 in a previous version and 999 in the 5010 version of X12. The provider inquires on a claim if the claim was delayed in payment, which is a 276 transaction. The health plan responds back with a 277 transaction. PCP makes a referral to send the patient to the specialist, which is a 278 referral transaction, and the health plan responds back at 278 with an approved or denied. Upon the visit to a specialist does an inquiry of 278, which is not a HIPAA compliant transaction, but it is an X12 transaction. The health plan responds back with a 278, a referral inquiry response. Health plan pays the bill, which is an 835 remittance advice, back to the provider. This is HIPAA's Administrative Simplification transaction set. Now let's look at HITECH Act's Electronic Medical Record transaction set flow. This adds a second health plan. For example, if the employer switches health plan 1 transfers health plan data, patient data to health plan 2, which is known as peer-to-peer personal health record. A provider inquires for electronic medical record. The transaction set is CCD inquiry and response back to the provider community. Not only that, the cloud can be further utilized for future document or form exchange between the provider and the health plan. Let's look at the advantages of horizontal architecture. It streamlines business processes. It's cost-effective implementation and expansion. It has embedded disaster recovery and business continuity architecture. It's a cloud-based configuration, and it complies with Affordable Care Act, HIPAA, and HITECH Act. As there are advantages of horizontal architecture, I would say there are also disadvantages. First, it's a rapid change in technical direction. Implementation will be in phases. There is a misconception of cloud-based computing model. Job shift from administrative to medical care. And corporations have to exercise change management process. Disadvantages will be there regardless of which approach we pick. The key is how we mitigate the risk factor and concentrate on opportunities that lies ahead of us. Putting more efforts surrounding rules published by Center for Disease Control. Research on how to early detect or prevent chronic condition. Research and development towards providing quality of care, and many other opportunities. I thank you for listening to my approach as a horizontal architecture to build a cohesive health information network and streamline business processes. I look forward in hearing from you. Thank you.